Today we're going to talk about the anatomy of articulation, part 1. So in this lecture we're going to discuss the articulatory system, the bones of the skull, the oral cavities, and the pharyngeal cavities. So we're going to be focusing on the throat and the mouth and nose regions. So the articulatory system, the outline for it is the articulators, the bones, and the cavities. So let's take a look. Okay, so what is articulation? So articulation is the joining together of two elements. So that's the definition of articulation. The articulatory system is just the structures that we use that are brought into contact with each other for shaping speech sounds. Okay, the source filter theory of vowel production. This describes how the oral cavity, so our mouth is our oral cavity, how the oral cavity shapes speech. So it states that a voicing source generated by the vocal folds are routed through the vocal tract, so through your throat, and then shaped into sounds of speech. So the vocal tract consists of your oral cavity, which means your mouth, your pharynx, which is your throat, and your nasal cavity, which is where your nose is. So here's a better picture. So here you can see the nasal cavity here. There's a title and then you can see the nasal cavity here. The oral cavity is the mouth here. And the pharynx is the throat, the back of the throat here. If you look, the oral, nasal, and pharyngeal cavities are linked like a series of tubes. So do you see this analogy up here of the tubes here? This is the nasal, oral, and pharyngeal cavities look like a tube. This linkage provides the variable resonating cavity that produces sound. So sound is produced here at the vocal folds, and the sound source comes up through the pharynx and goes in through the oral cavity and the nasal cavity, and the sound gets resonated. So when we actually produce speech sounds, the structures that come together are called mobile articulators, and these are things that move. So we know we produce speech sounds by moving our tongue, our velum, which is our soft palate in the very back of our mouth, our lips, our cheeks, the larynx, the hyoid bone lifts up when we're talking, the mandible is our jaw, and the pharynx is our throat. So all of these structures we use when we articulate sounds, and they all move. Now the immobile articulators that we use to produce sounds are the alveolar ridge, which is the little bump that's right behind your upper teeth, the hard palate, which is right beyond the alveolar ridge, and your teeth. Okay, so here's another view of the structures that we're talking about. So the nasal cavity, here's the oral cavity, the alveolar ridge is right behind your upper teeth, the hard palate is here, the soft palate or the velum is here in the very back. You can see the teeth here, the tongue, the mandible is the jaw, and the pharynx going down here. Okay, so now we're going to look at the bones of the face and the cranial skeleton, since all of these bones are used in articulation. So I'd like you to refer to table 6.1 in your textbook to look at the bones of the face and cranial skeleton. So the facial bones we're going to talk about are the mandible, which is the lower jaw of the face. The paired maxillae, these comprise the upper jaw. And the nasal bones, these are really small bones that make up the superior nasal surface. They form the upper margin of the nasal cavity. The palatine bones, these provide the rest of the hard palate. So the posterior 1/4 of the hard palate is made up of the horizontal plate of the palatine bone. The vomer bone, this makes up part of the nasal septum. And the zygomatic bone forms the cheekbone. So here you can see a picture of the vomer bone here in the nasal cavity. You can see the cartilage of the nasal septum here, the crest of the palatine bone here. This is just another view of the vomer bone, a left lateral view if you took it out. Now, the lacrimal bones, these are a small portion of the lateral nasal wall and medial orbit inside your eye. So these are really small bones that are almost completely hidden in the intact skull. They articulate or come together with the maxillae, the frontal bone, the nasal bone, and the inferior conae. They are a small portion of the lateral nasal wall and form a small part of the medial orbit as well. And then the hyoid bone just demonstrates that there's an interconnection of the phonatory and articulatory system, because the hyoid bone moves along with the articulatory system. Okay, so here's another view that you can see. It's an anterior view. And you can see the nasal bone here. The zygomatic bone. Do you see the cheekbone here? The zygomatic bone. You can see the vomer bone is pointing to in here. The maxillae, this is the upper jaw here. The mandible is the lower jaw here. And here's just an actual picture of a skeleton where you can see some of the same structures. So inside our cranial skeleton, there is the ethmoid bone, and this bone has a presence in the cranial, nasal, and orbital spaces, and it makes up the core of the skull and the face. So you can see this large ethmoid bone here. This is what it looks like, and it's inside of your cranial skeleton. Now, when we look at the bones on the outside of our cranial skeleton, on the outside of our skull, these bones lie over the lobes of the brain with the same names. So we have the frontal bone here, the parietal bone here, the temporal bones are on the sides, and the occipital bone is in the very back. And again, these are lying on top of the lobes of the brain with corresponding names. So here's a lateral view where you can see the frontal bone, the parietal bone, the temporal bone here, and the occipital bone here in the back. Some of the other structures that we've talked about so far are the zygomatic bone here, which is making up the cheekbone, the maxillae, which is comprising the upper jaw, the mandible, which is comprising the lower jaw. The alveolar process is the lower part of the maxillae. You can see the nasal bone here. Then also, like the ethmoid bone, located within the brain case is the sphenoid bone. And this bone is shaped kind of like a butterfly. So you can see the structures of the sphenoid bone, but we will not go into detail about the sphenoid bone. But just know it's located within the brain case.